都開會啦，咁
Our members will have attained the quorum. I now call the meeting to order. Today's meeting is about the pilot scheme on community care service voucher for the elderly. Shall we invite administration in as well, please?
好，我哋歡迎大概今日有20個團體。
We have 20 deputations joining us. We haven't quite started yet, pending the administration as arrival. I understand that there are members of the public in attendance upstairs, and on the third floor there are some senior citizens as well who are listening in to our meeting.
好，我哋歡迎政府代表。
I'd like to welcome from the administration, Principal Assistant Secretary for Labor and Welfare, Assistant Director of the Social Welfare Department and Chief Social Work Officer, Social Welfare Department. We're here to talk about the pilot scheme on community care service voucher for the elderly. These will come into being in September this year. 60 odd service providers have been invited, covering 1,200 people for 2 years. We have 20 deputations joining us today. Perhaps I'd like to invite administration to brief us on the paper. I think we have heard the administration's presentation, so please make it brief. The deputations will be given 3 minutes. 20 will bring us to an hour. You will not be protected by the Electoral Powers and Privileges Ordinance, so you will be held responsible for what you say. This is the rule that applies here. So without further ado, I'd like to invite Mrs. Eleanor Chan to brief us on the paper. Chairman, thank you. Thanks very much, deputations. It is our policy to encourage aging in place. Over the past years, we have been devoting resources to increase the quota for community care services, but that alone will not be able to meet the demand arising from the elderly people for the community services. So we have adopted the recommendations by the Elderly Commission made in 2011 for the pilot CCS voucher scheme to be implemented. We'd like to adopt this money follows people approach. The elderly people will be free to choose the services that are most suitable for them, and also the service providers. And that way we can have a more diversified range of services. We announced this pilot scheme back in 2011. The Social Welfare Department, together with the stakeholders, the NGOs and so on, briefed members on the preliminary ideas about this CCS voucher pilot scheme. Having collated all the views, we have the detailed scheme formulated for the CCS voucher scheme. Ms. Lee, I'll try to make it brief. In our contact with members, there are a couple of points of concern to members and the deputations. I'd like to hear more from them. First of all, Are we really in a position to launch the CCS voucher scheme? Are we ready for that? Will we be able to maintain the level of service that is needed? Second, there is this idea of co-payment. Will the senior citizens or their family members be financially able to make the co-payment? Now, this is the first phase of the pilot. What's going to happen next? This is of concern to the stakeholders. Now, first of all, in terms of quality, we are inviting the NGOs and the social enterprises that have had experience in community care services for the elderly to be involved. In terms of daycare and home help services, they do have a lot of wealth of experience behind them, so members can rest assured. Second, the ability to make co-payment. The senior citizens have to pay a minimum of $500 per month, and this is similar to the daycare centers charges. They are paying $900 per month. Now, we are talking about a part-time kind of service here. This should be affordable to them. With this concept of co-payment, we should be able to devote the resources to the elderly who are more in need. But this is a pilot, and this represents the first step. As to the second phase of the pilot, we will look at the elderly people with severe impairment, and the demand will be greater, perhaps. So this voucher value for the single mode may not be sufficient. So we have commissioned the Hong Kong U to conduct a study on different categories of needs. So in the next stage, we will cater for different needs that there may be different voucher values for elderly at severe level of impairment. What sort of services would they be in need of, and so on. All right, thanks very much. Right, I throw the floor open for the deputations. First of all, Mr. CHAN Wing-yin. 3 minutes, please. Chairman. Thank you. I've conducted some studies on the CCS voucher scheme. First of all, the locations are very limited. We're limited to 8 districts. Now, the quota is 1,200. According to the population census in 2013, those above 65 and above stands at more than 1 million. A moment ago, we talked about the Elderly Commission back in July 2011. It published this report. It took the administration 2 years to formulate this idea. It was only 0.1% of the senior citizens who would be able to get the subsidy, and this is wholly unacceptable. In terms of the vetting, they have to be evaluated as suffering from moderate impairment. Now, many of the senior citizens are more than moderately impaired, and they will be denied the opportunity in this exercise. And many senior citizens are concerned about the means test that would be undermining the family relationship because the family members have to sign a declaration of no support, no financial support for them, the so-called bad boys declaration. Now, the CCF also has the subsidy. I think this pilot is mutually exclusive with the CCF one. And I think this runs counter to the original idea of this particular plan. Now, in terms of the suicide among the elderly, of 100,000 senior citizens, 30 choose to end their own lives. And there are three major factors involved. Now, they're suffering from emotional problems, and they're suicidal. Professor Chiu, back in 1996, conducted a study of 55 senior citizens being suicidal. 49% of them are suffering from depression. Other than financial problems, many of the senior citizens indicated in the death note that terminating their lives would minimize the burden on their families. This CCS voucher scheme will make these services market-oriented, and there is no monitoring of the fees and charges, which can be very, very high, and the senior citizens may not be aware of their own needs. Thanks very much, Mr. Chen. Okay, Carer Alliance for People with Dementia, Ms. Chung-Yut-Kam. Chairman, I am Chung-Yut-Kam from the Carer Alliance for People with Dementia. There are a couple of points that have to be considered. First of all, dementia sufferers have their own unique needs. They are different from able-bodied people, and they have different needs for care. As the conditions worsen, the costs will creep up progressively. So the subsidies have to be adjusted accordingly. And I think we have to extend the scheme to those who are less than 60 years old and also moderately impaired. Second, we have to set up the day centers for dementia sufferers, because that would maintain the quality of life and also enable them to live a life without being hospitalized or institutionalized too soon. And third, the voucher cannot be regarded as a kind of subsidy. This is only a change of the mode of service. This is not any additional subsidy for the sufferers. And this cannot be regarded as an extra allowance for them. There shouldn't be any means testing. Fourth, there should be professional development. The government has to have a discipline course offered to train up people with the right expertise and right knowledge, and to enable them to look after these dementia sufferers. We urge the administration to address the needs of the dementia sufferers. There should be a task force which is tasked to formulate policies and provide daycare centers for dementia sufferers, and also allowances for the sufferers. I've got a couple of points to make regarding the CCS voucher scheme. First of all, it has to have regard to the needs of the sufferers at different stages. There shouldn't be any means testing mechanism. We hope that this pilot scheme will indeed address the needs of the sufferers and their family members. Thank you.
Labour Party, Mr. Lam Chong-ming, please. Thank you, Chairman. First of all, the Labour Party agrees with the principle of aging at home. However, we do have some suggestions on the implementation of the CCS voucher. First, it cannot replace the existing measures. Right now, the waiting time for elderly homes lasts up to 36 months, and a lot of elders have passed away while waiting for the elderly homes. The government should speed up the construction of new elderly homes to reduce waiting times, and the government does not have long-term planning on the caring services and to meet the aging trend of the Hong Kong population. Right now, Hong Kong only has 9,000 or so quotas for caring homes, which is less than 1% of the elderly population. And the 1,200 places for the CCS voucher is inadequate. On the long term, the government should increase substantially the number of places for social care. And second, the manpower for frontline carers is inadequate, and we face the problem of inadequate talents. And in the future, we are worried that even if the elders have this have the CCS voucher, they would not get the services they need. The government should increase the salaries of frontline workers. And thirdly, we are also worried that the elders do not know how to choose the right service providers, and the government should provide support on this front. And fourthly, in some cases, case managers might have a conflict of interest with the service providers. The government should perform necessary monitoring. And fifth, for the second phase of the CCS voucher scheme, the government is considering introducing private operators, service providers. And we are against this idea because these providers might not provide a consistently high level of service, and the elders might not be able to secure quality services. And we think that caring for the elderly is a responsibility for the government, and this should not be privatized. I think the CCS voucher scheme and existing elderly care services are not mutually exclusive. Ms. Stacy Kwan from Senior Citizen Home Safety Association. Thank you, Chairman. A lot of elders told us that they want to stay at home with the services, and as a result, we are very we agree with the idea of aging at home. Right now, our services are not limited to simple services like meal delivery. There is a big demand for other types of services. I have 2 points on the CCS voucher scheme. First, the co-payment arrangement. We think it's difficult for some users to share part of the fees, and they might not be benefited. Second, we are concerned about service quality. On service monitoring, I think this would be crucial to the success of the scheme, and we think there should be independent monitoring on service quality. Thank you. Next up, Elderly Community Care Services Concern Group, Ms. Tong Choi-ying. On the CCS voucher scheme, I think it's good to give the choices to the elderly. The elderly might face hundreds of service providers. I think for the responsible workers to explain all these providers to the elderly, it might be very difficult for them. We don't have additional resources on this, and this duty is taken up by social workers. I think the government should look at this arrangement. And I think it's not appropriate for the social workers of the NGOs to take up this responsibility because there might be bias. On the co-payment arrangement, for elders who are more well-off economically, they might welcome the idea. However, for other elders, they might not choose this option. I think this voucher scheme cannot replace existing long-term care services, including the HC services. I think the services should be enhanced according to the growth population growth rate, and the biggest expenditure is on frontline workers. This elderly CCS voucher scheme is for elderly people who are already in the net, but now the biggest bottleneck lies in the IHC. Just now, as some colleagues have mentioned, on case management, I think social workers have a big role to play in terms of helping elderly choose respective services. I think this should not be taken up by service providers because there's a conflict of interest in their roles, and we face inadequate manpower for frontline workers. We cannot hire people to take up these jobs, and even if the elderly have money, they might not get the services they need. The Federation of Hong Kong and Kowloon Labour Unions, Mr. Kwong Yat-fong. In recent years, we face population aging. However, the government does not have a long-term plan. In the name of aging in place, they are not doing their job or achieving the effects they want. The intent of introducing more flexibility in the elderly scheme is a good idea. However, we have some suggestions. A lot of elderly people told us they need eye care services and dental services. If we rely on healthcare vouchers, their needs cannot be satisfied. The government should do more on this front to satisfy the needs of elderly people. I think the pilot scheme is too narrow, and only elderly who have moderate impairment can benefit from the pilot scheme, and the elderly people with other levels of impairment cannot benefit. How much longer can the elderly people wait? So I think the scope of service of the pilot scheme should be expanded in order to achieve its goal. For private operators, their aims are to make money. The government should unify the charges for such services, and secondly, the CCS voucher scheme does not take care of emotional needs of the elderly. And the government does not have long-term planning for long-term care services. Our suggestion is that the CCS voucher for the elderly scheme can be integrated with other schemes such as health care voucher in order to have more so that more people can benefit. A lot of elderly people might give up applying for such help because of complicated procedures. The government should have an integrated and unified policy. And we should also introduce universal retirement protection and integrate it with our elderly care policy. Thank you, Mr. Kong. The Elderly Services Association of Hong Kong, Mr. Lo Wei Kai. We support the pilot scheme on CCS voucher for the elderly and the money follows the user approach. Right now, the current policy is inflexible. Our suggestion is when the government implements the voucher scheme, apart from daycare and home care services, the elderly people can use respite homes. The money follows the user approach adopted by the government allows more choices for the elderly. However, in the first phase of the pilot scheme, private operators are not in the picture, so the elderly have very limited choices and there's limited competition. As a result, service quality cannot be improved as a whole. The elderly care sector faces manpower shortage. The government is creating a big demand for carers. Right now, we have a shortage of thousands of workers, and service quality is inadequate. We do not have newcomers in the industry, and the overall service quality of the sector is compromised. Our question for the government is, where do we get frontline workers? Right now, elderly services are very controversial, and a lot of elderly people have passed away while waiting for elderly care homes. The government does not have any service standards, and it fails to consolidate public resources on the needy elderly. So apart from the CCS voucher scheme, the government should implement elderly home vouchers in order to implement the money follows the user approach. The caretakers concern group, Ms. Chiu-hung. Some people doubt that the CCS voucher scheme is an excuse to get away from increasing elderly home places. From 2012 to 2016, only an additional 500 places will be introduced every year. And this is less than the 700 or so places introduced per year in the past. And the number of places introduced is less than the number of elderly people passed away last year. And this means that a lot of elderly people cannot choose elderly homes, and they can only go for the CCS vouchers. They have no choices, and they are just waiting for their time. They either have forced options or no option at all. The government should announce the number of available places in public elderly homes every day. The number of staff has to be increased. It's a last resort for the elderly to enter elderly homes. If we have enough home support services, we do not oppose the idea of aging at home. And disability allowances also have to be announced, have to be enhanced. And for elderly people who have severe impairment, they have to be entered into elderly homes in priority. A lot of these elderly people with severe impairment have urgent needs to enter elderly homes, and only a very small proportion can enter these homes. It's sad that the government is using the excuse that carers have the responsibility to take care of their family as an excuse to shy away from their own responsibility. We should implement universal retirement fund so that the elderly can choose the services they want. A lot of elderly people do not apply for help because they don't want their family to feel hard.
跟住請
Thanks very much, Madam Chiu. Next, we have Mr. Lai Ming Lai, Elderly Welfare Concern Group. Chairman, thank you. In the previous term of administration, the government privatized some of the services, and they introduced the operators in the market, and they have introduced the healthcare voucher scheme and this CCS voucher scheme, and the situation is going from bad to worse. Now, what are the major problems? That is the privatization of the elderly care. Now, there is this means test arrangement. The needy people will have to be subject to the means test of the 1,200 quota. How many of them will be able to make it through the means test? A lot of the elderly people who have the need have been subject to this unified assessment mechanism, and they will be subject to another round of means test. I'm wondering what sort of system are we talking about? Are you torturing the senior citizens? We do have doubts about the effectiveness of this CCS voucher scheme. As I said a moment ago, in this means test mechanism, you will end up with about 1% of the senior citizens who will benefit from the scheme. What is the point of having a scheme like this? Now, we do have doubts about this aging in place idea. If you want to implement aging in place, you have to have regard to the financial situation of the senior citizens, their need, the caring needs, and so on. And we also have to consider whether the senior citizens are suitable for aging in a particular district. If there is a lack of services in the community, then the family members may not feel at ease about leaving the senior citizens to age in place. Now, we have some recommendations. We are against the introduction of the CCS voucher scheme, and we should not. We should arrest the trend of further privatization of elderly care. Furthermore, there are many frail elders in the CCS or in the home care. There shouldn't be any means test to be imposed on the senior citizens. We should have the retirement protection on a universal basis. That would enable the senior citizens to choose their retirement life. All right, Mr. Ng Kin Wing, Grassroots Development Center. Chairman, thank you. I have an elderly person, 88, blind, bedridden, who has to be waiting for 5 years for a home to be given. We hope that the administration will do something about the need of those who are on the waiting list for a home. And you are not heeding our advice. I think you're merely tinkering around the edges, and you are putting forward this idea of a CCS voucher scheme, which is not very much sought after. I find this wholly unbearable. I've said this some years ago, and I say this again, that we come here to LegCo not because we want to have this CCS voucher pilot scheme, and you're merely offering a quota of 1,200 people. Honestly, I like to remind the deputations today what we seek to have is to improve the the services for those on the waiting list for a home. I'm trying to debunk the myth here. On the 22nd of August 2011, when you talked about this particular scheme, you said that the institutional care will not be affected. Now, I've logged on to the SWT website, and I've also gone back to the budget and the PA over the years. Now we have 29,000 senior citizens who are on the waiting list, up by 10,000 over the past 5 years. Now, not to mention those who passed away waiting over the past 5 years. In the budget, there has been an increase of 3,600 over the next 4 years. There will be 2,300 additional places. Now, the figures never lie. I think it is the administration that are lying, that are playing with the figures. Now, you're spending $380 million for 4 years to deal with the 1,200 senior citizens with a moderate impairment. Now, we have 29,000 senior citizens who are waiting for a home. I've got a senior citizen at home who's waiting. Why do I leave or keep my senior citizen at home? Not because we want to allow him to age in place, but because we want to be with him in the twilight years. I think it all depends on whether the family members have the ability to look after them. We do need a home. We've been waiting for 3-4 years now. How soon are we going to get one? In our submission, time is limited. We have put forward quite a lot of recommendations. Now, we are against this CCS voucher scheme, which is putting the cart before the horse. I think we should have a long-term policy on elderly care instead of just tinkering around the edges with this CCS voucher scheme. I think we should not be means testing these senior citizens who have been contributing to society. There should be a universal retirement protection for them to decide whether they like to age in place or whether they like to go to a home. All right, thanks very much. And next, Mr. Zeko Man, Civic Party Chairman. We support the idea of the phased implementation of the CCS voucher scheme, but the administration has to assess the needs and affordability of the senior citizens. They have to look at it from the user's point of view, in particular those isolated senior citizens and poor senior citizens. There shouldn't be any mismatch of resources. We have to make it convenient for the senior citizens in order to achieve the purpose of aging in place. Second, the CCS is the value is $5,800, but the daycare it is $7,800. In other words, the senior citizens will have to make up for the difference. That this differential will be met by the same amount as the food money. This Civic Party feels that this would impose a very heavy burden on the senior citizens. The government has $60 billion in surplus, and I don't think there should be any idea of co-payment. Now, since we're dealing with money follows the users for the pre-primary education, the same can be said about this CCS voucher scheme. The Civic Party feels that the government should alleviate the burden of the senior citizens. The new policy has to be convenient and conducive to the citizens. I think at a later stage, this will be extended to the private operators. The private operators vary in terms of their quality of service. We do have reservation. I think through the SWD, those homes with experience should be allowed to be expanded to provide more places. The Civic Party subscribes to the idea of aging in place. I think we should have the care and retention home and the homes for the elderly in the equation. It would take 35 months for a place in the home, and there are 2,000, 3,000 senior citizens who will pass away waiting. So while you implement these programs, there should be more resources to improve the care for the elderly. For those full-time carers, they've given up their full-time job in order to care for the elderly. In Hong Kong, we don't have any retirement protection. We believe that the CCS allocation should give due recognition to these full-time carers of the elderly. Well, next, we move on to Mr. Kwong of the Hong Kong Senior Citizens Interest Alliance. Chairman, I am Kwong Wing-tai from the Alliance. In the third quarter of this year, the CCS voucher scheme will come into being. And I don't think we should bring this about until the services have been improved, because the government doesn't have an idea how the fees and charges will be regulated. Now, with the voucher scheme, the fees will go up to $400 instead of $200 for the basic service. Will the CCS voucher scheme be good enough? Now, for those with severe impairment, if they are subject to inhumane treatment, they would find it very difficult to lodge a complaint. It would be very difficult for the government to regulate the market. Until we have put in place a regulatory system for the private market, we should withhold the CCS scheme. The administration emphasizes the idea of money follows the user. With the voucher, the senior citizens can purchase the services. Does the administration know about the manpower shortage in the private sector? The government doesn't seem to have any ideas. According to the Elderly Commission, the community care services lag far behind the RCHE service, and many senior citizens are in dire straits. Now, the money doesn't come from the recurrent funding. It comes from the Jockey Club, a lottery fund. It would be very difficult to have any guarantee of funding. So it shows that the government is not fully committed to the care for the elderly. They are implementing this pilot scheme. There are so much implication on the senior citizens. The government should review the policy in its entirety. Right, next, Chung Kwat-o, Senior Citizens Concern Group, Mr. Kam Chuk-kin. Chairman, the Social Welfare Department launches this CCS voucher scheme. A moment ago, many speakers already said that this pilot arrangement is on an experimental basis, and I don't think it is. I don't think it sounds right. We would just like to highlight one point, and that is the means testing. And this is discriminatory to the senior citizens. Of whom I am one of them. And for the pre-primary kids, they have the voucher scheme applying to them, but they don't have to be means tested. But senior citizens have to be means tested. We have toiled our whole lives. We made our respective contribution to society. We've raised our families. Today, we are old and infirm and frail. We're in our twilight years. It is very much the time that we need a helping hand from the administration. And you are subjecting us to means test. Why is the government so heartless? Now, we have the Madam Lee from the Social Welfare Department. We put in the same request every time. Now, for senior citizens who are living with their family members, they have to means test the entire family. Do you really need to have the declaration for not supporting the parents? And I mean, this CCF voucher scheme will subject the entire family to a means test. I mean, we don't really know about how much they make per month because they do have their own privacy. For senior citizens to apply for the CCS voucher scheme, they have to be means tested. I mean, not to, they find it too much of a hassle, not to mention losing face. And this would drive a wedge between the senior citizens and their kids. And many of them would choose not to be subject to the means test. Now, the CCS voucher is about aging in place. I think this is running counter to this idea. I think you have to be friendly to the senior citizens instead of being discriminatory. You should remove all kinds of means tests.
Thank you, Mr. Kam. We are very clear. The Democratic Party, Mr. Ricky Orr. Thank you, Chairman. The SWD launched the first phase of the CCS voucher scheme, and up to 1,200 vouchers will be issued. And the pilot period will be 2 years. We have some suggestions. The money follows the user approach allows elderly to have more choices. We think the concept of the CCS voucher scheme is satisfactory. However, given the choices, the elderly might not have enough information about the service providers in order to make an informed choice. Therefore, the government should ensure that the elderly understand the nature and services provided by different providers. And some groups also pointed out that the a monitoring mechanism is very important in order to ensure the quality of services provided. And the administration should review the voucher value of regularly in order to ensure whether the elderly people can purchase the services they need with the value on the voucher. Facing population aging, we need to provide a service pledge for the elderly. The administration must ensure that eligible elders can receive the services they need in time, so that the elderly can receive the care they need. While implementing the voucher scheme, different factors have to be taken into consideration in order to really benefit the elderly. Facing population aging, the government should enhance community support services and establish a long-term social welfare policy. Lion Rock Institute, Ms. Sarah Pemberton. Thank you. The use of public money on the CCS voucher scheme is should be encouraged. Utilizing the CCS vouchers to support the elderly's lives is very effective. When distributing the vouchers, the government should look at the affordability of the elderly. Right now, the waiting lists for elderly homes are very, very long. and the elderly people have to wait a long time to get to receive a place in these homes. And the voucher scheme enables the elderly people to receive the services they need in a short time. We hope that the elderly who really need a place in residential homes would not have to wait for long. By allowing the elderly people to choose the services they need, we can ensure a more efficient distribution of tax income. And the government has to listen to the pledges of the public. And I want to list a counterexample here. In the past, the government has given out subsidies regardless of the income levels of different elderly people. The government should ensure a more balanced distribution of the services, and we should not subsidize elderly people who are well off already. We should encourage the youth to work hard in order to solve poverty. Mr. Kwok Chin-yin from Elderly Services Concern Group. Thank you, Chairman. I'm very unhappy about how the government is treating the elderly. Over the years, the government has done a lot of different things to deceive us, but this is all empty talk, and they have not done anything. They talk about caring for the elderly, but they have not implemented anything to serve us. They consider the elderly black sheep, and they consider us burdens. If we want to see the doctor, we have to make reservations, and the elderly people don't know how to make reservations since their health conditions are not good, and as a result, the elderly cannot receive the medical help. This is all empty talk from the government. When we see the doctor, let's say if we cannot walk, we have no one to take care of us, and the government is making up excuses. They say they don't have enough beds, they don't have enough places. If the elderly are living alone, they won't have anyone to take care of them. We are talking about elderly people who are 60, 70, or 80 years old, and we need people to take care of us. However, the situation is right now, we don't have people to take care of us in the middle of the night. The government is irresponsible, and they keep telling us to go home. Some elders have multiple illnesses, but but they say we're okay and we can go home. Some elderly people are not so lucky, and some elderly people are left at home with no one, and no one care about them. The Elderly Rights League Hong Kong, the Elderly Community Services Concern Group, Miss CHAN Wing-yin. I'm just an ordinary elder, and I want to share some facts with you. I used to work in a private elderly home. I think the idea of the voucher scheme is good. I want to tell you the real situation of elderly homes, and we have inadequate manpower. Every time when the government makes unscheduled inspections, we know when they are coming. We know how to get around those inspections. The fact is, there's not enough staff in the elderly home, and the elderly people are the ones who suffer. They pay, but they do not receive the care. So I hope the government can step up monitoring for private elderly homes. I want to take this chance to raise raise my opinion on behalf of the elderly. Sometimes the elderly cannot visit doctors in time. They have to wait a long time, especially for specialized doctors. They might need to wait for 1 or 2 years. I hope the government can subsidize elderly who are 65 years or above so that they can have an annual body check, so that they can start waiting sooner when they find out their health problems. I have nose allergy. I live in a subdivided flat. When I saw the doctor told me to breathe through my mouth. And this caused a lot of inconvenience. When I visited the doctor again, I was prescribed antibiotics and different medicine, and I was arranged a lung screening. The results were all okay, and I was visited by social workers, and they said, you might choke on the long run. You have to see the doctor to see if there's any if there are any further health problems. And at the end, I found out that the root of the problem is my nose. So at the end, I wasn't given antibiotics, and I was given nasal prescriptions. I hope the government can provide an annual body check for elders.
Right, next, Elder Rights League Hong Kong, Ms. Big Sum, Chairman. Ladies and gentlemen, I am living all by myself, suffering from all manner of illnesses. I have rheumatoid arthritis. My joints are really wobbly. I mean, I look fine, but I can't even take off my my shirt. I can't wipe the windows. How can I find somebody to help me? I really can't find anybody to help me at all. rheumatoid arthritis. Well, I have to walk sideways when I'm walking down the stairs. I can't even do anything at all. And I mean, really hardship. I hope that you would be concerned about the home alone senior citizens in Hong Kong, like myself, because we cannot turn to anybody for help. I am inarticulate, and the only thing I want to say is to say a big thank you to everyone. All right, Miss Angela Chan, so-called. In 2011, the Elderly Commission put forward the recommendation for the CCS voucher scheme, pilot scheme, to be introduced in September for 4 years. We have discussed this idea, and we are against the implementation for the following reasons. First of all, the services will be privatized and will be market-oriented. Currently, the services are provided by the Social Welfare Department on a contract basis. The NGOs are making available the services, but in the days to come, one will have to go to the private sector for the services. The users will have to pay anything between $500 and $2,000, and the services will not be regulated properly, and they may be overcharging. In the market, we have the emergency alarm and the private clinics, and a lot of the senior citizens have to go to the private homes because of the inadequate supply in the public sector. And people do have a lot of negative criticisms about them, and they're not providing the services that they pledge. If we move towards privatization, the services will become unregulated. Second, the services or the CCS voucher scheme is too complicated with a lot of doubts hanging over us. This may sound an awful idea, and because this is an idea, the idea of money follows the users. But we do have doubts, like this $500 charge. Will the government offer any subsidies? This $58 to $100 voucher value, can this be carried forward if it is outstanding? How can people purchase the right service? Will the service providers be sufficiently experienced? Would they be able to handle the sheer number of applications? At the end of the day, the money will not follow the users. The money will be squandered on places that are not needed. Furthermore, will the services will the policy address the manpower shortage? The community services are grossly inadequate, undermining the quality. Home cleaning, meal delivery, there is a need for improvement. The new policy simply cannot address all these inadequacies and come up with improvement measures. And the senior citizens simply run out of enough people to look after them. Finally, there is no long-term planning, and the government doesn't have any commitment. There are only about 100 places available in each district, and I hope that the administration should consider the responsibility that should be undertaken by the administration. Right, thanks very much, and let's move on to Harmonic Recreation Society, Mr. Li Wai. Now, since Mr. Donald Tsang became chief executive, the policy has become stagnated. Now, the policy on elderly care has been a fiasco. We would like to endorse, however, this CCS voucher pilot scheme. If we wait until everything has been finalized before implementation, it would take another decade. I hope that we should make improvement as we go along. However, there is one thing that we find wholly unacceptable. like Director Lee said, they will hire those NGOs that have experience, i.e. those NGOs that currently providing services. But as I said, the elderly care policy has been a fiasco. Now, with a hopeless chief executive formulating these hopeless policies, providing these hopeless services. Today, the government said that they want to discard the old and establish the new. But you are allowing these hopeless organizations to run them. I can't really grapple with the logic. But this is becoming imminent, and this will come about in September. I don't think there is any way we can change the way forward. But we would like to urge the administration that in September, when you bring in the CCS voucher pilot scheme, you have to abide by these free market principles. There should be more choices. It's just like the beef market. It is dominated by a couple of suppliers. There is a lack of competition. How can you ensure that there would be good and inexpensive services? I'm sure that the members of the public would know what good and inexpensive services would be available. There shouldn't be any. There shouldn't be too many thresholds, and make people choose between rotten apples and rotten oranges. How soon will the quality framework be introduced for the caring sector? How soon do the senior citizens have to wait before there would be enough manpower? I look forward to documentation from the administration and an undertaking as to how long we have to be kept waiting before we see enough manpower. All right, then, thanks very much. We have heard from 20 deputations, and let's invite the administration to make a response. Let me briefly sum up what we've heard. In terms of caring for the elderly, this pilot scheme is of a small scale. We have close to 30,000 waiting for a home. Now, with this pilot scheme covering 1,200 people, you're going to drag it out for 4 years. We're not sure how much this would be of help. Now, from the deputations, we get to understand that they are resentful of the means test element, because this would be another form of the decoration, the bad boy decoration, as it were. There may be difficulties presented to the families. Now, it would be important to make available the information that the case managers are not independent. He may be a social worker of an institution, and he may be biased in favor of his own institution. So this kind of arrangement has been called into question. The monitoring of the quality of service is another element. This would attract some of the manpower away from the areas that are most in need. This scheme will not make any difference to the inadequacy of these services. With the introduction of this, it doesn't mean that you have to rest on your laurel. Now, in the Poverty Commission, they are looking at the subsidies, and this is mutually, the two seem to be mutually exclusive. The Secretary and the CS already said that if they go for the CCF subsidy, they will not be allowed to choose the CCS voucher scheme. And also, those suffering from dementia, in the market out there, there is a lack of choices. For those below the age of 60, who are nowhere near being a senior citizens, but if they are suffering from dementia, they will not be eligible for the CCS vouchers. So I hope the administration will address all these points. We have Mr. Peng Chiu-hung and Mr. Peter Cheung on the list. Mrs. Chen, please. Chairman, thank you. Thanks very much, deputations, for their views. As you briefly summarized a moment ago, Mr. Chairman, you've highlighted some of the concerns. Let me first of all address the policy matters before I call upon my colleague from the Social Welfare Department to fill members in on the details. Now, this pilot scheme will run for 4 years, and the first phase will be running for 2 years. As the name implies, the pilot will be tried out in 8 districts. And we have a look at the number of service providers and also the number of people. We have set the quota of 1,200. But as I said previously, as we go along, if we find that the service providers will still have capacity for more services, then we will consider whether the quota can be adjusted. But since we are bringing this about in September, we'll see how we go before we can supplement further. Many of the deputations expressed concerns over the means test as well as the co-payment. If I may say something about the underlying principles here. Now, in the Elderly Commission's report, it is pointed out that the government does have the obligation to provide the services. But in terms of fees and charges, other than being borne by the taxpayers, there should be a shared responsibility here. So that's why, well, as a matter of fact, the users have to pay for the services. And this is by no means a new arrangement. Under the CCS voucher pilot scheme, we have put forward this co-payment idea. We find that those with greater affordability should be made to bear more of the costs, because that way we will be able to devote the public resources to those who are more in need. Now, we are testing the income of a household and not the assets, and this is something I'd like to clarify. Regarding the details of the means test, perhaps I defer to Mr. Chan for further details. Now, the chairman mentioned that we don't have any intention of introducing this CCS voucher scheme in place of the current services. In the budget, there would be resources that would be devoted to increasing the number of homes and also the daycare places. Some deputations queried why the CCS voucher scheme is applicable to the elderly with a moderate impairment. Now, as we said before, resources are finite. We have to devote them to the elderly who are most in need. So in the community care services or the home services, they will be subject to an assessment, and we are making it available to those with moderate impairment. In terms of manpower, there were a lot of comments made about this at this subcommittee. In fact, we did have a fair amount of discussion here. Now, in terms of professional manpower, occupational therapists and physiotherapists, we have increased the number of places. We have devoted $100 million to increase the places for training for nurses by 1,000 for frontline workers. We do appreciate the difficulties there. Now, in fact, we have had a lot of discussions before, in particular as to how we can entice more new entrants. Now, there was a mention of the QF, the qualification framework. We hope that within this year we will be able to delineate the academic attainment requirement. Now, through the designation of the QF, there would be a career path for young people. We will be able to entice more young people into this particular trade.
And on the voucher scheme and carers scheme, they are both pilot schemes. As we mentioned in the meeting last time, right now the pilot scheme on carers allowance, we don't have details yet. However, both are pilot schemes. If we allow the uses of both pilot schemes to overlap, it might be difficult for us to assess the effectiveness of both schemes. Under the carers allowance scheme, we will study whether they also benefit from other schemes. I have some points to make on quality assurance. The SWD will conduct scheduled and unscheduled checks on service providers. We will check their archives, their service hours, fees, etc. I think the best form of monitoring is for the elderly people to make their choices. If the elderly is not satisfied with the specific service providers, they can use their vouchers on other service providers. So we are concerned about service quality of different providers in the first phase of the scheme. We hope in the second phase of the scheme we will know the standards required for home-based care services. I hope we can give the elderly a choice, and so that they can vote with their actions. Mr. Tan, on means tests, I want to make a few points on means testing. This is not a new thing in Hong Kong. We have fees in place for existing community care services. However, means tests are not meant to serve as barriers for elderly people to receive services. We have 5 tiers. We will look at their income, and second, we would look at their household income. For example, some elders might have a lot of kids. As a result, they don't need to declare their incomes. If elders have kids who don't live with them, they might need to declare their pocket money given by their kids. The arrangement is the same as the existing scheme for elders who receive CSSA. And existing CSSA recipients can apply for special grants. For elders who receive CSSA, they pay $500 per month. They can receive an reimbursement of $149 a month under single mode. And this arrangement is very similar to the existing scheme, so I hope you can understand our arrangement. I believe a lot of you still have a lot of questions. Everyone, each of you can have 4 minutes each. Thank you for the comments. We all agree that the vouchers cannot replace elderly care homes. I have a few questions. Just now, as the Assistant Secretary said, the scheme the pilot scheme will launch in September. We will have 1,200 places. We have 62 service providers, so each provider will have 10 or so receive 10 or so vouchers. My question is, do the responsible workers have to be consulted in order to use the vouchers? And the second question is about manpower. We do not have enough frontline workers. You talked about training. In theory, if you have conducted an assessment for the scheme already, and the 1,200 vouchers should be enough. So what kind of adjustments are you looking to make? How can you ensure enough manpower to operate the scheme? And the privatization issue. The government is looking to expand privatization. If we talk about private sector, we're talking about money. Do you have a monitoring mechanism in place? Can you answer these questions, please? 3 questions. So maybe I'll answer the first question and Mr. Tan can answer the second. If on the question whether elders can put their hands up and say, I want to take part in this pilot scheme, right now we are looking at 8 districts. This pilot scheme is applicable to 8 districts. We will provide the necessary information to the responsible workers, and in the coming July or August, the workers would have provided, would have prepared the relevant pamphlets and information, and they will introduce the scheme to the elders and their families, and the elders would have enough time to consider whether to accept the idea of the voucher scheme. And we would also invite elders who are on the central waiting list for elderly homes. How many people among those 8 districts are on the central waiting list? How many elders are on the waiting list? In these 8 districts, we have around 8,500 eligible elders. However, we do not expect all of them to choose the pilot voucher scheme. And the manpower issue, when these 62 service providers apply to us to become recognized service providers, they need to sign service agreements or consent forms with us. They have to declare how much manpower they would dedicate, and we will assess the situation. The capacity they promised by the service providers actually exceed 1,200, but we are adopting a more conservative approach to see whether all the providers have enough manpower. Some elders might be inclined to specific service providers. So I believe the manpower issue is not a problem. At this point, most recognized service providers provide a small number of places, between 18 to 20. So we are not talking about one provider giving a lot of services. And Mr. Peter Chung. Thank you, Chairman. As I've always said, this is the first step towards privatization of service provision. However, the pilot scheme is going to be launched very soon, so I can only ask a few questions. First, when we talk about moderate impairment, can you tell us what kind of services do they really need? And the $5,800 for CSSA recipients, they cannot pay more because of the co-payment arrangement. What kind of services can they receive? As you know, for OTPT services, they need to pay at least $600 an hour. If the services provided are similar to daycare services, is this really viable? Just now, Mr. Tan mentioned that each service provider or social enterprise would serve 18 to 20 elders only. How can these providers make ends meet? Even if you give them all the money, they only receive around $100,000 a month, and they still need to hire. They need to reserve money for hiring people. So it's quite certain that they will lose money. From a business standpoint, it's very hard for them to make ends meet. I believe I have 4 minutes, so I will give around a minute for the administration to respond. Mr. Tan. Moderate impairment is a more clinical definition. To put it in simple words, we are talking about people who are not very mobile. They are suffering from chronic diseases, and they cannot take care of themselves in daily lives. They need services. For example, diabetes patients, arthritis patients. Can you make it brief, please? I think Mr. Chung wants to know what kind of services are needed for moderately impaired patients. And the question is $5,800 enough? Right now, this sum is benchmarked against our the fees of daycare services. we believe that the amount is adequate because it's taken on the current fees of daycare services. If the patient goes to daycare centers, I think the daycare centers can serve more elders if the staff do not have to make visits to their homes. I think we can take care of that question in the second round.
Thanks very much for joining us. But I don't think your concerns are being addressed because they are regurgitating the same old replies that we heard last time. We're not hearing anything that we don't already know. I think they are really regurgitating word for word what they said before. And this is regrettable. What's the purpose of having a meeting today? The Bureau and the Department are rehashing the same old line to take. And what more can we get out of them? This is end of June. Let's go will rise for the summer. So how much can we squeeze? How much more can we squeeze out of the administration? We're not even inching forward. From the deputations and the senior citizens, and they they are very resentful of the means test, but the government is still taking their heels in. The pilot will run for 4 years, 2 at a time, but many of the senior citizens may not be able to wait that long. There are 20,000 people who are waiting for a home. There are many. In fact, we are talking about more than 20,000, but here the quota is 1,200. What sort of expectation can we pin on this administration? These are issues which are very urgent, but the administration seems to be dragging their feet, and they are making sound as if they are doing something with this pilot scheme. So is it really enough to address the needs of the senior citizens? Well, I mean, with such minuscule services, how will we be able to address the problems? This CCS voucher scheme is merely symbolic. It doesn't achieve anything tangible. If I may put this to the Bureau and the Department, can you specifically offer a glimmer of hope for the senior citizens? Can you show them in no uncertain terms that you're offering concrete services for them? Now, even with the implementation of the CCS voucher scheme, you will benefit 1,200 people over the next 4 years. What about those 30,000 people who are on the waiting list? Are you turning a blind eye to them? Don't you have any empathy, any compassion for these people? So, Chairman, even if we cover 1,200 people under this voucher scheme, what about those 20,000 people on the waiting list? Mrs. Chen. Thanks very much, Mr. Leung. Well, we said before that this CCS voucher scheme will not be a substitute for the current services. Well, will you dare to substitute that? I mean, it is a superfluous for you to say that. Well, for the homes, now we have the board place scheme. It would take time for us to build our own homes, and land is also another issue that they will have to contend with. I, like members, would like to have more homes to be made available. But I mean, as I said, I don't have a magic wand. I mean, I can't snap a finger and build so many homes all of a sudden. Now, with this voucher scheme introduced, we still would devote resources to the current services. Now, this 1,200 represents the first phase. We'll see how we can improve the services in the next phase. But what Mr. Leung said is that you will not substitute the home-based or center-based services, but I don't think you are speeding up the services on the other side of the equation. In terms of the RCHEs, you have 700 or so over the past couple of years. In the coming 4 years, you would have 500 or 570 or so. I mean, this is wholly unacceptable. Chairman, I fully appreciate members' expectation. I would like to see more built sooner. At the moment, I don't have the paper with me, but in our previous papers, we said that in the coming 3 years there will be 7 contract homes that will be coming on stream. We have 8 sites that will be zoned for elderly homes. But I mean, these are the figures that these are not figures that are cast in concrete, because we are identifying sites and that will become available. If there are suitable sites, we will grab them for this purpose. And I hope that members would appreciate it. From now to 15, 16, there will be 1,500 places. But if we can identify more land, the number will keep increasing. Mr. Leung Kwok-hung. Well, Chairman, I don't think you would dare substituting this for the existing services. But the problem is you are trying to quell the dissatisfaction. 07 to 12, you have 3,600. 12 to 16, you have 2,300. The number has come down, and you are introducing this pilot scheme to cover 1,200 people. I think this is too much of a coincidence. Now, Mr. Matthew Cheung keeps saying that Legislative members should not be too critical. We should not be focusing our attention on the RCHEs alone. Now, you said that the pilot would be running for 4 years, 2 at a time. After the pilot scheme, what's going to happen to this scheme? Will you extend this to cover all those who are not given a home? You haven't got the commitment, you don't have the leadership, you don't have the ability to execute the policies. After the 4 years, I can guarantee, I believe you can guarantee that those who don't have any homes will be given this service, while at the same time to speed up the production of the RCHEs. And I don't think you can give us this kind of undertaking. And this is a merely empty talk. These services will be provided by the same kind of organizations. I'm not sure some organizations are doing this as a favor, or would they be making some profits? Are you asking the NGOs to take on more services? Whereas it is public knowledge that they will provide the services according to the resources. How can we monitor these services? How can we check up on the quality of service? For those organizations that don't have sufficient resources, they just do a perfunctory job. I think this is like a tasteless piece of chicken. It is too much of a waste to discard it. This may sound good on the surface, but I think I have to show up your evil. Can you give us the undertaking that if this pilot proves to be a success, will you extend this to cover all the senior citizens who haven't been given a place in the RCHE? And how many homes will there be in the market? Do you have any plan there? Mrs. Chen. Thanks very much, Chairman. Thank you, Mr. Leung. Now, for this CCS voucher scheme, of course, if this proves to be a success, I would like to implement this fully. Now, for a scheme to be a success, we have to find out whether the senior citizens are prepared to subscribe to this kind of service. Now, some are concerned that despite the vouchers, that we may run out of NGOs providing the services. If this proves to be a success, we will not be too miserly. We will not be limiting the number. Well, some of the senior citizens can choose either the center-based service or the home-based service. But as we emphasized before, this is entirely the choice of the senior citizens. Some of them may prefer to have the RCHEs instead of the CCS. Now, we do respect the right to choose, and there may be a situation where the senior citizens may not want to opt for this kind of service. So how many RCHE places will there be? Now, for those who are not given a place in the RCHE, will you extend the CCS voucher scheme to these people? Mrs. Chen. As I said before, from now to 2015-16, we have 1,200 places and that would become available. We have 8 sites that have been set aside for homes to be built. Now, Mr. Leung referred to the commitment to cover all the senior citizens on the waiting list for a home, or whether this CCS voucher can be extended to all of them. At this point in time, I'm afraid I cannot give you the undertaking like this. Why not? Chairman, as I tried to elaborate a moment ago, it is not difficult to make available the CCS vouchers, but we do need to have the service providers in the market who are ready to provide the services. Well, so despite the vouchers, they cannot buy the services. Well, I wouldn't say that. I mean, in the 8 districts, we have 60-odd service providers. Going forward, are we going to have a more diversification with more service providers? This is something we'd like to see happen.
That means you won't promise? Mr. Joseph Lee, I have some questions. We welcome the pilot scheme. If we have 1,200 vouchers, that means at least 1,200 elders can enjoy aging in place, and they wouldn't need to enter elderly homes. However, I don't understand the principle that the more capable elders should pay more. and these elders have to declare their income levels. I think this is very confusing, and we also some people are also worried. So if this concept is so confusing, when you eventually implement this pilot scheme, they might distract some elders might be distracted from applying for the scheme. Can we have a simpler co-payment arrangement? You pay $50 and I pay $50. I think it's very confusing if we pay both parties pay different fees. For CSSA recipients, the service providers only receive $2,000. If the original fee of the service is $4,000, what do the providers do? How can they make ends meet? The providers probably won't be providing services if they can receive more money. I was quite concerned about the question raised by Peter Chung too. Right now, the minimum wage is $30 an hour. If we talk about more complex home-based services, if the carer stays for 1 or 2 hours, they might need to spend 3 hours, including transportation time. Assuming the carer receives $30 an hour, he or she will only get $90. And if I really don't know how the NGOs can pay its workers if they only receive so little money. I think we should make this clear so that the service providers would at least understand how they can help. I think we should make this clear so that our efforts don't go in vain. Mr. Tan. For the $5,800, it's a fixed fee. If the service provider receives an elder, the institute would receive $5,800 no matter what kind of services they provide. For low-income elders, for example, elders who only pay $500, the government would subsidize $5,300. And no matter what the combination is, the service providers always receive $5,800. So their incomes can be guaranteed. We try to we eliminate means testing. All these elders in the scheme are on the central waiting list. They all have a case manager, a social worker following up on their cases. Since May, we have conducted a lot of briefings with officials from these 8 districts, and later on we will have detailed application forms to help the elderly. They can look at they can check which income brackets do they fall into in terms of household median income. And social workers are there to help. In August 2012, we consulted a lot of service providers. We invited expression of interest from different institutions and consulted their comments on the implementation of the scheme. And for the 62 service providers, they all agreed to the arrangement. We asked them what they would, what the elders would do with $5,800. We give them different choices. For example, they can visit daycare centers twice. They can use home-based services for 8 hours. And they also have a mixed option. They can visit daycare center for 1 day and enjoy 18 hours of home-based services, showering, rehab exercises, escort services. We provide all these information to the elders and their families. And the service providers have made their pledges, and this makes it easy for us to monitor the services. Thank you, Mr. Tan. Time is very limited. We still have questions from Helena Wong and Peter Chung. Helena Wong. Thank you, Chairman. If the elders want to use this $5,800, do they have to use the services on a bundled basis? Do they have to visit the same institute? Can they use different service providers? For example, they consult one institute for physiotherapy and another institute for home-based services? No, the answer is no. So that means we have very little flexibility. So they have to adopt packages. At the moment, the answer is no. However, they can choose different service providers each month. If they're not happy with one provider, they can switch to another on during the next month. We have to balance interests, and at the same time, we have to allow for flexibility for the elders, and we have to consider the manageability of service providers. Different elders might have different needs for different caring needs, different levels of caring needs. In some cases, $5,800 might not be enough to pay the bill, and they might need help from their family members. Would you consider their level of needs and adjust the fee? In phase 1 of the pilot scheme, we adopt a fixed rate of $5,800 because these elders have very similar needs. And in the second phase of the scheme, in 2015, we would consider helping elders with severe impairments as well. We have commissioned a university to look at different cases because different elders have different levels of needs. And through this study, we might consider vouchers of different values. But right now, we are only at the start. Some elders might be smarter and they might know how to choose the right provider, the right services. However, some elders might feel confused because they have very little knowledge of these providers. So on the central waiting list, would you ask your social workers to locate these elders actively and tell them and introduce different packages to them, or do these elders have to approach you? Ms. Lee, as I said, each elder is managed by one social worker. one responsible worker, so you can be assured. Our current approach is very effective. All the social workers are trying their best to help the elders receive the most appropriate services for them. However, there might be a conflict of interest because the service providers are also the case managers. In this pilot scheme, we will assess. We don't have service providers in attendance today, but through this pilot scheme, we will see. We want to see whether the public is concerned that the service providers are only concerned with making money. We will certainly follow up on this. Ms. Helena Wong, we have a potential area of concern here. However, the quality assurance, we need a quality assurance mechanism for all the service providers and service packages. So who would be responsible in monitoring their quality? Quality assurance, as we have mentioned already, all service providers are NGOs with considerable experience in elderly care services or social enterprises with considerable experiences. The SWD would also adopt 16 quality standards, and we will make inspections. However, the most important thing is the elderly themselves. If they are not satisfied with a particular service provider, they can easily switch to another anytime. I think we should empower the elderly. We should not consider them inadequate or unwise. If they are given choices, I'm confident that they can make the right moves for themselves. I want to give myself a few minutes. As you might realize, I think in essence the pilot scheme is taken up by existing departments. I think that the burden is on existing service units, no matter what kind of services we're talking about. However, we have to realize that right now resources for the existing service units are inadequate already, especially manpower. When we talk about professional manpower and frontline workers, we don't have enough of them simply. This is a very strange situation. People are lining up for services, and service units do not have enough manpower. They do not have enough land. And when we are introducing this pilot scheme, which puts even bigger strain on the existing manpower, and this means the quality of existing subsidized services would be compromised. I think this pilot scheme is not very sensible. The government is not working on reducing the waiting times for existing services, and we are even introducing means testing. Let me make it clear. It's household income restriction. When we talk about daycare centers, home-based care services, we have two different fees. One is for CSSA recipients. For other recipients, the fees are very low. Even if you visit a daycare center for 5 days a week, you pay $900 or so a month. Right now, the level, the fee affordability is at $2,500 a month. If the pilot scheme is implemented on a permanent basis, all our existing elderly care services might be means tested. Right now, I cannot stop this pilot scheme, because this scheme is not does not require vetting from LegCo. The money needed for the pilot scheme comes from the lotteries fund.
同日金
With regard to the home-based services and the daycare services, they are mutually exclusive. To avoid institutionalization, you have to have the two going in tandem. Like the NGOs, they work on the basis of the number of days they spend in the daycare centers. Now you are covering about 9,000 people, and you're making them mutually exclusive. Either you use the daycare centers, or you use the community services. I think you have to make them to break down the divide between them. Can you address this, please? Mrs. Chen, have you looked into this? Well, Chairman, now for those using the daycare centers, the daycare services, they cannot use the home-based services, and that's why we have this mixed mode service, whereby they can utilize the daycare as well as the home care services. We'll try to find out whether the senior citizens would favor this. We'll find out whether there is a room for improvement. Under this pilot scheme, the service providers will provide the daycare, the center-based or home-based daycare services, and they would be in a position to have the two kinds of services supplementing one another. Under the conventional mechanism, they may not have the same interface between the daycare and the home care services. At the present moment, I cannot say that we will be able to achieve that. What the constraints arise from the existing policies, and it is also an administrative problem. You're not looking at the needs of the senior citizens. I think there should be a proper interface between the home care services and the daycare services. I think you are hiding behind your policy in this regard by saying that you'll find out whether this is going to be popular with the senior citizens. I think you have to start with the needs of the senior citizens. I mean, it's no good for you to say that you have made the arrangements for the NGOs. Well, we started off with a clear dichotomy between the two, but in fact, the senior citizens their needs may not be met by one single kind of service. That's why we have brought in this mixed mode delivery. I'm not really against you. My question is, why don't you open up the existing services and to allow a mixed mode delivery, Madam Lee? Well, for daycare services and home care services, there is no objection for them to be mixed, but you're a bit concerned about the mixed mode. This CCF voucher scheme is a new idea. I think we have to let it run its course. Chairman, you mentioned the existing centers. Now, for daycare services and home care services, we have dozens of service providers. If we're going to make major changes, it would take time. So at the moment, we are introducing this voucher scheme in order to try out this subsidy. But at the same time, we are looking at the interface between daycare and home care. And I hope that 2 years down the line, we should be in a position to know how we should go. Well, you have 31 organizations involved. Perhaps we extend the meeting by 15 minutes. Mr. Peter Chung will end the meeting by 6:45. 3 minutes, please. You've got a point there, Chairman. I think we're beginning to see the effect of the vicious circle because the private sector and the public sector are competing for the frontline manpower. This CCS voucher scheme will be luring a lot of the frontline staff into the service, and I think this is a vicious competition. This $5,800 service instead of 10 people, you may end up with 8 people because the personnel costs will be higher. Second, in relation to the case managers, they belong to the service providers. However objective you are, they have to be answerable to their bosses. Will you be observing the order of your bosses? Chairman, if I may be bold enough to ask the administration to come up with a few more $1 million to hire social workers who don't belong to any of the organizations. Well, you need 8 social workers for the 8 districts. It would cost you something like $4 million. You can have a couple of NGOs looking into this. And these social workers will be liaising with the 1,200 elderly people and come up with a review for the social welfare department. Because at the end of the day, we'll have to ask the service providers for their views. And the senior citizens may not be articulate enough to give their views. And they may switch from organization to organization, and they don't have a clear picture about the situation. So if we have social workers who are neutral and independent, who can get in touch with the service providers as well as the senior citizens, it would be more impartial. Mrs. Chen, independent case management system, you would by hiring another batch of social workers. Chairman, I don't think there is any room for this to be done at this stage. As to the second stage, how will we go about monitoring the situation and also the case management, we'll consider this. Well, if you don't try this out at this pilot stage, what's the point of having the pilot? Well, there is no room to change anything for the time being. Right, we have aired our views. Deputations it is really hard for you. I mean, you can only shake your heads in the face of this administration. As far as they are concerned, the long-term care for the elderly is something that they have very little commitment for, and they've been dragging their feet all the way from the previous administration and the previous administration before that. For those waiting for CHEs and for those waiting for home care, I mean, the queue is lengthening as we speak. Now we're going to have some money from the Lotteries Fund for this pilot scheme, which is subject to a means test, and this is filling us with worries. If they are not facing up to the issue sincerely, then the long-term care for the elderly is going to get even worse. Because if we're going to extend this voucher scheme, then lots of resources will be devoted to this by the service providers. And there will not be any improvement to the services, and this privatization is really something we do dread. Well, I hope that the users will contribute their views more. Well, I don't think this 1,200 quota will not be the answer to the problem. At the next meeting, we'll come back and have a look at the inadequacies regarding the long-term care, manpower, accommodation, and resources. We don't have an answer to all these problems. We hope that at the next meeting we'll revisit this issue. It would be difficult to get blood out of stone, that much we are aware, but we'll try our best, because at the end of the day we're dealing with the plight of the senior citizens who have made contribution to our society. Well, I do hope that you will heed their advice and make as much improvement as possible. Right, that's it for today. Thank you all very much.